Dear students, let us continue our topic, that is estrogens. In this session, we will study about selective estrogen receptor modulators, their uses in our body, and their adverse reactions. Before starting with the selective estrogen receptor modulators, let me first remind what is first agonist and antagonist. Coming to the agonist. Agonist is that chemical moiety which binds to the receptors, and causes action. Means a chemical substance when binds to any particular receptor, it causes an action. We call that chemical moiety as an agonist. And now antagonist. Antagonist is that chemical substance which when binds to the receptor blocks the action of agonist. An agonist causes action while as antagonist blocks the action. This was agonist and antagonist. Now coming to our topic, that is selective estrogen receptor modulators. These are the substances which act on estrogen receptors. These act on estrogen receptors. However, they act as an agonist at some places and antagonist at other places. Agonist at some places and antagonist at other places. Means these selective estrogen receptors show tissue selective action. They show tissue selective action. These selective estrogen receptor modulators act on the estrogen receptors and show their action depending upon the tissues. For example, they act as an agonist at they cause agonistic action at bone, liver, and on lipid metabolism. Means these substances will perform actions like that of estrogen in case of bone, liver, and on lipid metabolism. And will block the actions on and will act as agonists and will act as an antagonist at breast, pituitary, and endometrium. So these substances, these selective estrogen receptor modulators will block the actions of the estrogen on breast, pituitary, and endometrium. This was their action, principle of action. Now let us study about the commonly used serums. Commonly used selective estrogen receptor modulators. Commonly used serums include number first, tamoxifen. Number 2, Raloxifene. Number 3, Tormifene. Tormifin. Number 4, Ormeloxifene. Ormeloxifene. These are the commonly used SERMs. Let us first study about tamoxifen. Tamoxifen shows tissue selective action and causes, number first, it inhibits the proliferation of tumor cells in breasts. That is, it decreases the risk of cancer, breast cancer. Next, it stimulates the proliferation of endometrium. Endometrium means the risk of endometrium is with endometrial cancer is with tamoxifen. Next, it reduces bone resorption. It decreases bone resorption, which leads to the decreased risk of fracture, decreased risk of bone fracture, because it inhibits bone resorption, which leads to the decrease in the risk of bone fracture. Next, it decreases the LDL. It decreases LDL. LDL is a low density lipoprotein. Means it decreases the cholesterol in our body. These were the uses of tamoxifen. Now, side effects. Its side effects include nausea, vomiting, vaginal dryness, and increase in the risk of endometrial cancer. Endometrial cancer. These were the side effects. However, it is used in breast cancer. These are the uses of tamoxifen. Now, Raloxifene. Tamoxifen and raloxifene has the same uses, except that it does not stimulate uterine endometrial proliferation. Tamoxifen and raloxifene, same uses. Difference lies here that it does not stimulate uterine endometrial proliferation. Raloxifene is indicated, means raloxifene is used in the prevention of postmenopausal osteoporosis. It's used there when there is a menopausal osteoporosis, we give them raloxifene. Next is tamoxifen. It has a similar actions that of tamoxifen and is indicated in the, it is used in breast cancer, postmenopausal breast cancer. This was the use of the tamoxifen. Now, antagonist of estrogen. One of the antagonists of the estrogen is fulvestrant. It is an antagonist of estrogen and is indicated in the breast cancer. This is also indicated in, this is also used in breast cancer. Where tamoxifen, where the body is resistant to tamoxifen. So these were the common SERMs used and antagonist used. For further details, we will continue in next session. Thank you.